The World Federation of Hemophilia is an organisation that improves and sustains care for people with bleeding disorders. It was founded by a person with haemophilia who recognised very early on the importance of the partnership both with the people who have the disorder and also with the clinical communities that look after us.
The board has 14 individuals, about half of which are lay and the other half are medical. The lay portion of the board are individuals that are affected in some way with hemophilia, either a family member or an individual with a bleeding disorder.
Over 130 member organisations vote at a General Assembly to elect board members, and that includes both the clinical board members and also the lay members.
Not only we have balanced representation from healthcare professionals and patients, but also a representation from all over the world, all continents in the world.
Which is making this board extremely interesting because you have to deal with a different culture, with a different type of thinking.
I think WFH is rather unique as a patient organization in as such that all stakeholders are represented either in the board or in different committees of the organization.
Having a board that has both patients and healthcare professionals, doctors and others on, leads to better policy because you have two very different perspectives. You have the technical and diagnostic and treatment expertise, but then you have the patient experience.
Policies from one perspective never really work. A policy, for it to work in a healthcare setting, needs to involve collaboration between the physician, the healthcare providers, the patients, and their family members.
And a lot of the patients who come are also volunteers, so they know programming well. They experience firsthand how it works.
In order for there to be true sustainability and spread of initiatives, it's important to have people on the board who understand the realities on the ground.
Diversity of background leads to amplify and magnify the level of the debates.
If you don't have diversity on the board, then you've got a lot of people who are speaking on behalf of groups, and they're speaking on behalf of those groups with very little experience to draw from in real life.
Communication and discussion is the best way to make a decision. So I mean, if I think from my point of view or on my angle of vision, and the patients or the people, I wouldn't say the patients, the people with the problem talk from their angle, it's too far from each other. But discussion and dialogue brings things much closer together.
It's also important to remember that it is the lay perspectives that bring their other professions that go well beyond living with the bleeding disorder to the table. So what you've actually got is a much more diverse board that can make better decisions.
The reality on the ground is you have doctors and patients there as well. So as we deliver programs on both sides of that spectrum. But because our programs are informed by a group that's combining both those perspectives, I feel we can better plan for programs that are more effective in both those spheres.
So we have to respect the medical sector because they have the knowledge in terms of how it's possible to care, professional care to person with hemophilia. But at the same time, the people who really support and make the work day by day, every day, in order to support their work, is the lay sector.
It is a good model also for the advocacy, because it is the patient who are the best people who can make advocacy to the government.
So working together in front of the health authority, making the same proposal and using the same arguments. That is the key for if you want to have this success in front of the health authority.
It can't be only, the patient can't go alone because they need the support of the doctors, but the doctors also can't go alone. They need the support of the patient because ultimately that's where the society is providing the health care for.
I guess in any board where you've got a diversity of membership and people are coming to the table with strong views, there is a danger there.
Respect and listening is key. Sometimes the challenge is that I get so locked in my own perspective I don't listen well.
Trust needs to be involved, and with trust comes the ability to have very candid conversations, disagreements, arguments, and then consensus building.
A board like we have here at WFH is only functional when everyone around the table is as an equal. So I don't see patients around the table and I don't see doctors. We're all sitting there as board members.
I think overall, we do well at showing respect and listening. Part of that is being deeply committed to all the people that don't have treatment.
To have a board that has all the, not only competences, but also to have that broader view for society, that's crucial.
We've got a terrific model where patients and healthcare providers can come together and further the progress in this particular disease.
When you have a team of patients and doctors together, you're getting the best of both worlds. If there's good open dialogue where people are hearing, you'll make better decisions. I can't imagine a better model than bringing those two together.